Good morning, students. We will continue with the topic we were studying about reproductive health. Today, we will study about medical termination of pregnancy and sexually transmitted diseases. Medical termination of pregnancy is one of the most widely used method of fertility control in the world. It is defined as intentional or voluntary termination of pregnancy before full term. That means voluntary termination of pregnancy before the fetus become viable. By statistics, about 45 to 50 million MTPs are performed every year all over the world, and this is 1/5 of the total number of conceived pregnancies in a year. Therefore, MTP have a significant role in containment of population, though they are not performed for this purpose. They are mainly meant for removing unsustainable pregnancies. MTP has also been a debatable topic in many countries due to emotional, ethical, religious, and social issues. In India, since 1971, MTP is legalized with some strict condition to check its indiscriminate use as a method to abort female fetus. This act was amended in 2002. Under this act, termination of pregnancy can be done up to 20 weeks if the pregnancy is likely to produce a malformed child is a result of rape or contraceptive failure or is likely to harm the mother. Now, MTP are recommended by doctors under certain medical conditions when the pregnancy is fatal for either the mother or fetus or both. So, MTP is done to get rid of unwanted pregnancies, casual unprotected intercourse, failure of contraceptive used during coitus, rapes, and if there is likely to produce a malformed child. Normally, MTPs are considered to be safe up to 12 weeks of pregnancy, that is the first trimester. Later, as the development proceeds, MTPs become riskier for the female and if it is not performed by a qualified doctor. Okay. Now, what are the drawbacks of MTPs? MTP is being misused to abort even the normal female fetuses. In India, it is being illegally performed by unqualified quacks and therefore it is unsafe and may result in the death of mother. Another dangerous trend is the misuse of amniocentesis to determine the sex of unborn child. We have seen what is amniocentesis, that it is a medical procedure used in prenatal diagnosis of chromosomal abnormalities, okay, where the amniotic fluid is taken and then it is analyzed, okay, and if there is any serious defect is found, then the termination of pregnancy is advised. But this technique is often misused to determine the sex of the child and so to abort the female fetus. Now, abortion refers to the premature expulsion of the conception products from the uterus, usually before the 20th week of pregnancy. An abortion may be spontaneous, naturally occurring, sometimes called a miscarriage, or induced intentionally performed. When birth control methods are not used or fail to prevent an unwanted pregnancy, induced abortion may be performed. Sexually transmitted diseases are highly infectious disease that spread from an infected person to a healthy person by sexual contact, and they are also known as venereal disease or reproductive tract infections. Some of the common diseases are gonorrhea, syphilis, genital herpes, okay, hepatitis B and AIDS. Now, what are the mode of transmission? Okay, so mode of the transmission occurs by the following ways: sharing of injection needles, surgical instruments, okay, then sharing the unsterilized surgical instruments, transfusion of blood from infected person to healthy person, infected mother to fetus. Okay, now what are the early symptoms of sexually transmitted disease? So early symptoms of most of these are minor and include itching, fluid discharge, slight pain and swelling in the genital region. Okay, now the patient remain undetected and untreated due to absence or less significant symptoms in the early stage of infection or social stigma attached to the sexually transmitted disease. Now, this social stigma is a major cause, which means individuals affected by STDs like AIDS face discrimination in the society and they are often rejected by the families and their communities. Hence, all sexually transmitted diseases have a social stigma attached to it. Okay, so in early stages of infection, the person may fear to seek proper medical treatment and this may lead to complication later. Thus, absence or less significant symptom in the early stage of infection and the social stigma attached to STDs deter the infected person from going for timely detection and proper treatment. So, a result of delayed treatment could be pelvic inflammatory disease, abortion, stillbirth, ectopic pregnancy, that is, it occurs in fallopian tube, infertility, or even cancer of the reproductive tract. That means sexually transmitted disease are a major threat to a healthy society. And prevention or early detection and cure of these diseases are given prime consideration under the reproductive health care programs. Though all persons are vulnerable to these infections, their incidence are reported to be very high among persons in the age group of 15 to 24 years. Okay. Now, some of the common sexually transmitted diseases are HIV. Causative agent is human immunodeficiency virus. Then gonorrhea caused by bacteria. Syphilis again caused by bacteria, that is Treponema pallidum. Okay, so please learn this chart. And these diseases are caused by microorganisms like viruses, bacteria, protozoa or fungi that are passed from one human being to another by sexual contact. Okay, so this table refers some of the common sexually transmitted disease. So most of these diseases are curable, though there is no definite cure for AIDS till now. Okay, now this is the chart of some commonly sexually transmitted disease with their causative organism and symptoms. Now here causative organism, here it is written bacteria, and in the earlier slide I have given the name also. Okay, so gonorrhea caused by bacteria and the symptoms are it infects mucous membrane of the urinogenital tract, then genital discharge and painful urination occurs. Syphilis, it causes sores and lesions in the genital tract, burning sensation at urination. Then trichomoniasis, again vaginal irritation, itching and discharge. And AIDS, it destroyed the immune system of body, persistent cough and fever, and then body is attacked by other diseases like pneumonia, TB and certain cancer. So in most of the cases, the common symptoms are burning sensation at urination and discharge from urethra or genital tract. Hepatitis B and AIDS, apart from sexual contact, can also be transmitted by sharing needles, surgical instruments, transfusion of blood from an infected mother to fetus also. Okay. Now, except hepatitis B, herpes and AIDS, other diseases are completely curable if detected early. So with this we came to an end, okay, of this session. So please keep learning and keep revising, okay. Now all these which we have studied today, please refer your NCERT. Next we will deal with the infertility and assisted reproductive technologies. So that's all for today. Thank you.